Hello, my friend supporter. I am a representative of Dr. Mohammad Shulchudri, MSCOO7. Mohammad Shulchudri. As per I know, Allah best not a new best part of subject. Security privacy purpose not excluded. Hamas on yeah, Alif Lam Lam. Yalla Shakir Namukin. Now I those are visiting me as a doctor. Now medical science class. As a student of medical science, I wanted to take flavor every part of substance. What kind of things say to that is bad, that is knowledge, that is different, that is good or that is not. As you must realize the one and only kid is about the owner can understand this topic now. Now my patient saboteur. Hypernatremia. The treatment of hypernatremia, you know that, and hyperkalemia. What is hypernatremia? The sodium chloride is increased. What is the problem of hypernatremia? Everybody know? In hypernatremia, sodium increase. You give distilled water in IV and urine route. Sodium is gone. How gone? In sodium potassium ATP pump, you remind 3 sodium from inside to outside, 2 potassium outside to inside. In hyperkalemia, what happens? Potassium, hyperkalemia treatment is dangerous. Glucose insulin pump, insulin pump, 2.5 milligram unit of glucose can 1 unit of insulin. Then calculation is necessary in hyperkalemia. That is dangerous. In hyperkalemia, in case of ionic imbalance, hyperkalemia is more dangerous. In hyperkalemia treatment, glucose insulin give glucose in neutralize glucose, and potassium sodium glucose co-transfer in kidney. Sodium glucose or potassium glucose. If sodium reduce, then if sodium glucose co-transfer sodium reduce, then what happens? If sodium, I also not I read, but I also learn. Sodium glucose, what happens? If you say sodium reduce, then 2 sodium inside to outside, 2 potassium outside to inside entry. The potassium level correct? Okay, fine. If give potassium, okay, fine. No problem. I also a student. I also not know the mechanism. Now I understand that mechanism. Everybody understand? Understand. In sodium potassium cell pump, ATPase, you know that 3 sodium inside to outside, 2 potassium outside to inside. When sodium glucose ATP pump, in kidney remains sodium glucose ATP or potassium glucose, sodium glucose. When you give that IV is in glucose co-transferred to sodium. If sodium reduce, then 3 sodium inside to outside, 2 potassium outside to inside entry. That is the hyperkalemia treatment. With the how much potassium reduce, how much potassium increase, there is a solution. Mathematical calculation. How much potassium reduce? How much potassium reduce? How much potassium increase? You give that much in 2.5 gram. 2.5 gram glucose neutralize 1 unit of insulin. Then glucose unit if give not neutralized by insulin, what happens? Glucose level increase. Then in hyperglycemia. That is the reason mathematical calculation necessary. How much potassium increase, that much glucose given, and sodium glucose transferred in kidney, and then potassium enter into potassium outside to potassium, inside into cell. In that position, heart rate increase. In heart rate increase, medical science say, then what is the treatment? Cardiogenic shock. If cardiogenic shock develop, heartbeat reduce the 40, then atropine. If reduce the 30, 20, 30, give the adrenaline. Although I give, if go to the 20, below the 20 adrenaline, but you not take risks, you give the adrenaline below 30 in cardiogenic shock. Understand? But that is the medical science treatment. If you give distilled water, IV distilled water in hyperkalemia and hypernatremia, what happens? Hypernatremia, sodium outside remain, in cells remain isotonic 0.9% sodium chloride solution, and outer environment now buffer. If fluid increase, what happens? Tonical balance, for tonical balance, sodium. For tonical balance, normal saline, if you give cell, what happens? If blood remains sodium, more sodium, if you give blood distilled water, more sodium go to the, by kidney automatically go to the reduce the sodium go to the, there is a sodium channel also potassium channel, sodium potassium ATP pump, more fluid given, then sodium, 2 sodium enter into cell and 2 potassium enter into cell, 2 sodium go to the outside, correct? By tonical release of the blood volume. Understand? Yes. Not understand, I think so. No. Understand. Just you give the blood volume, urine come. Try to understand. In urine come, in urine go to the hypernatremia, go to the sodium to the urine. In hyperkalemia, you give the distilled water, the potassium go to the kidney, and you know that in hypernatremia what happens? Hyperkalemia very, very much dangerous. You give the not glucose, insulin, you have not any, you have distilled water, you give the distilled water, not normal saline, you give the distilled water, then for tonical balance, potassium is more, go to the urine. By water, hypernatremia, hyperkalemia we can treat. You can believe that? Not so. Immune system. Still now researchable. Okay? Take the patient consent and give. Hypernatremia, hyperkalemia by distilled water we can treat. Fine. Now hyponatremia you reduce sodium level, give the sodium chloride, sodium salt, sodium chloride salt. In hyperkalemia, KT syrup, potassium syrup. Fine. Try to understand, I think better understand. What's my friend about that? Interesting. Still now interesting. The distilled water is no need calculation. How much? There is a calculation also. And urine output chart data. How much urine output? Intake output chart, fluid intake output chart. 5 liter blood, you gave to 1 liter more fluid. 1 liter fluid. For example, not take 1 liter, you give the 450 milliliter. 1 bag blood, 1 bag fluid, 450 ml. 450 1 bag for hypernatremia, hyperkalemia. Then when reduce potassium, you understand that. When check the potassium level, come in normal position, then stop. Just like a magic. Especially hyperkalemia is more dangerous. Just like a magic wand. What happens? Without glucose, insulin pump. Also in medical science, glucose insulin pump method. Understand? I think better. And 2.5 gram glucose neutralized by 1 unit of insulin. Medical science class. Understand? I think better understand. Now ionical imbalance, there is a hyperkalemia more deadly, dangerous. Thank you very much, my brothers. Now that is enough to prove who am I, what am I. Doctor, that is the proof. That is enough to any doctor know that, any professor, no, all over the world. If know that, I salute you. Thank you very much. Except Dr. Mohammad Shul Chaudhary. I also, Dr. Mohammad Shul Chaudhary, say that when complete the MBBS degree by distilled water, hypernatremia, hyperkalemia can treat. Now I, as a person, I say that. Thank you very much. My friend supporter, today is enough from medical science class. Next time, next lecture, we discuss elaborated that. Understand? Now treatment of hyperkalemia more dangerous. What is the reason and mechanism? Yes. Who is not understand? Raise hand. Everybody is understand. Okay, no problem. Who is not understand? Who is understand? Please help him. ज्ञान बांटने का है, ज्ञान दाने बाढ़े की पुनः बढ़े. If your friend, help him. And those are not understand, who is your friend, find out and take help. Thank you very much, my friend, for supporter. Today is enough for medical science.